Welcome to Link 2025. I'm Naga Kandasamy and I'm based at King's College Hospital in London. And it's a great pleasure to have Alejandro Tomasello, one of our colleagues from the Vall d'Hebron Hospital in Barcelona. And it's lovely to have Italo Linfante, one of another neuroradiology colleagues from the Miami Neurosciences Institute in Miami. Thank you very much and pleasure to have you here.
Thank you.
I'm just going to ask Italo the first question. You're a very experienced interventionist and you've been doing lots of interventional work over the years. Can you tell me your own experience with flow diversion in particular and tell us about the direction of travel in which you think flow diversion is heading, please?
Thank you, Naga. It's a great question. So flow diversion for me is very passionate because I see this field from the beginning. I work with Dr. Wakel, who actually invented flow diversion. And so flow diversion, for people who don't know, it's a device that we use to treat aneurysms, changes the flow inside the artery and closes the aneurysm. And that can be used for aneurysms that are considered impossible to treat, like dissecting aneurysm, giant aneurysms, and we publish on that. So it's an amazing idea of a device that for our armamentarium of devices. The challenging with flow diversion is that once you place a device, once you have a device which is very thick mesh, it's difficult to deliver it and take the turns of tortuous vessels. And so with industry, we've been working with the engineers about developing devices that they adapt very well to the arterial wall, even in challenging conditions like extreme tortuosity, giant aneurysm, dissecting aneurysm, and they're easy for the operator to use. And I think we have reached this level. With the device that we have nowadays, we can treat complex aneurysms like we showed today, giant, dissecting, large aneurysm, reconstruct the whole artery with the device. That is, it's possible, and these things were impossible a few years ago. On top of that, besides giant aneurysm, on the other hand, we have small aneurysms like blister aneurysms, and for blister aneurysm, flow diversion is an excellent choice.
It's nice to know that things have gone in the right direction. We're certainly able to do more complex treatments,
Absolutely.
Which once upon a time were deemed quite high risk and probably
Absolutely.
not treatable. We are able to do that as well.
Absolutely, yeah, we're treatable things that in the past were not possible to be treated. So patients that were desperate, patients with these horrible conditions, and we can treat them and they go home the day after and they're fine. So it's amazing.
Yeah, lovely, thank you very much. Just moving on to Alex, again in your own experience as well, so we've got this new class of intrasaccular devices that have come out. I say new, they've been around for a fair amount of time anyway, so relatively speaking. So how have you adapted to that? How has your practice changed with all these devices? If you could share that with all of us, please. Thank you.
Thank you for the question. Yeah, intrasaccular devices, I think it's a great step forward in our field. And specific with contour, we started using in bifurcation aneurysm, and very soon we realized that the tremendous effect of this device, and also we can move to another indications, like for example sidewall aneurysm, because we think we can reduce the antiaggregation using this kind of devices, and more we are understanding the way to use it. Also, of course, the main idea is to one shot and done. But also we know if we really want to expand the indication, also we can use with other devices like a stent or coils, okay? And more I see the potential in the future to use probably rupture aneurysm, but still we have to understand how to manage in this scenario. And regarding this point, what do you think about if still there is a space for the coils, or in specific in small aneurysm, and what do you think about the new technology with the coils?
Yeah, so this is interesting. So we've all sort of had a chat about sort of flow diversion, intrasaccular as well, and we are aware that a lot has progressed in this sector completely. With the coils, you get the feeling things have been a little bit stagnant and very little has changed. But if you were to look at one device that would treat most aneurysms, you're still looking at coils. So the coils do still have a role, is our own take on this. Still is the longest follow-ups we still have is for coils anyway. So our take, at least in my own practice, is that coils still have a role in going ahead with treating most aneurysms. I think flow diversion, intrasaccular devices, they're all welcomed additions as well. But I think we need to be aware that coils can't be ignored, at least not yet, is the way things are going. And in terms of the evolution of coils as well, I certainly think some of the coils like the tortuous, for example, which we sort of discussed earlier on about as well, particularly for treating small aneurysms, they just decrease the risk profile of treating such small aneurysms. And in an acute setting, for example, although we could potentially flow diverse them, it negates the need for antiplatelets as well. So I think coils still have a role. And again, as we discussed earlier on, sort of a combination of all these devices, it gives us the option to treat different aneurysms using the optimum device, because we need to have lots of devices, and this is where we've had good support from colleagues in industry as well, so forging ahead with new technology, so we have lots of choice so that we can find the right device that fits the aneurysm that we want to treat.
Absolutely, I think that's a great point that you're making. We can personalize basically to the aneurysm, specific aneurysm, the best treatment to treat our patients. So it's amazing to have multiple choices, like the Tetra, like the intrasaccular device, the Surpass Elite or Surpass flow diverter. So it's really, really very grateful to working with all of you guys, and congratulations for presenting these cases today. They were really very interesting, amazing. Great job to all of you.
Thank you very much. And it's been mutual learning for all of us as well, and it's great to share everyone's experience with us. Yeah. Okay, thank you very much, everyone. Thank you.
Thank you.